Good evening, folks. This evening's topic C, facing Medicaid cuts. Wisconsin families stockpile medical supplies. Headline context. This headline reflects a deep human response to looming policy changes. Families in Wisconsin who depend on Medicaid are stockpiling medical supplies out of fear that proposed cuts will destabilize their access to care. It's not just about hoarding, it's about survival, dignity, and preparing a system that may no longer reliability support them. What the surrounding page likely describes. Community impact. Local reporting captures the voices of parents caring for children with disabilities, seniors managing chronic conditions, and caregivers who rely on Medicaid funded supplies to keep loved ones safe at home. Policy backdrop. The story is set against proposed federal budget reductions that could shrink Medicaid's reach, forcing states to just 1 second, guys, I'll get it for you. Cut services, tighten eligibility, or reduce reimbursements. Public interest framing. Regional outlets emphasize the ripple effect. How a national policy debate translates into everyday anxieties for Wisconsin households. Why families are stockpiling. Coverage uncertainty. Families worry that essential supplies, catheters, feeding tubes, incontinence products, wound care, wound dressings, and durable medical equipment may no longer be covered or may require burdensome prior authorization. Supply disruptions. Cuts could delay or outright denials, leaving families scrambling to fill gaps. Financial risks. Many households cannot afford sudden out-of-pocket expenses. Stockpiling now is a hedge against future costs they may not be able to bear. Psychological security beyond the practical. Stockpiling provides a sense of control in otherwise unpredictable policy environment. Anticipated impacts in Wisconsin. Service reductions. Home and community based supports could be scaled back, leaving families with fewer caregiving hours or reduced access to specialized programs, eligibility tightening, stricter income and medical criteria may push borderline cases off Medicaid, particularly those with complex but not categorically severe needs. System strain. Without consistent supplies, preventable complications could drive more ER visits and hospitalizations. Ironically, rising long-term healthcare costs. State level consequences. Wisconsin's Department of Health Services has warned that cuts could affect nearly 20% of residents, including 40 of birth and 60 of nursing home residents, underscoring the scale of potential disruption. Human stories that anchor this page. Parents of medically fragile children, a missed shipment of feeding tubes or catheters can mean hospitalization. Families describe the terror of imagining those gaps. Adults with disabilities, day programs, and assistive technologies funded by Medicaid are lifelines for independence. Cuts threaten not just health, but social participation. Caregivers' coping strategies. Stockpiling is portrayed as both practical and desperate. Families filling closets with supplies because they cannot trust the system to deliver tomorrow. Emotional tone. The reporting conveys anxiety, urgency, and resilience. Families are not passive victims. They are actively preparing, even if the preparation feels like a last resort. Bottom line, the headline encapsulates a defensive protective behavior rooted in policy risk. Wisconsin families who give me 1 second, guys. Rely on Medicaid are stockpiling medical supplies because they fear losing coverage, facing delays, or absorbing costs they cannot afford. It's a vivid illustration of how abstract budget debates translate into concrete everyday actions. closets full of medical supplies, households bracing for uncertainty, and communities caught between political decisions and lived realities. Okay, guys, that's your extra one tonight. I will see everybody tomorrow for shows. Have a good evening, folks.